Do you also wake up in the morning, touch your neck, and wonder why this pain is here again today? Do you feel while working on your laptop or phone that your shoulders have become heavy like stones? And the worst part, when you put your head on the pillow at night, does it feel like instead of sleeping, you're fighting some battle? If yes, then you're not alone. Millions of people around the world are struggling with this silent epidemic every single day. And today, I'm going to tell you where this pain is coming from, why it's happening, and most importantly, how to eliminate it forever. Look, neck and shoulder pain isn't just ordinary pain that will go away by taking an aspirin. It's your body's alarm, a warning signal that something is wrong. And I'm saying this because I've felt this pain myself. Imagine this. You're sitting in the office preparing for an important presentation, and suddenly such pain strikes your neck as if someone gave you an electric shock. Your hand automatically goes to your neck. You press it, rotate it, but there's no relief. This is the biggest irony of modern life. We made life easier with technology, but we turned our bodies into torture chambers. Think about it. People yesterday worked in fields all day, lifted heavy loads, but they didn't have this pain that we're experiencing today just by typing on a laptop. Why? Because their posture was natural. Their body was in movement. Look at today's lifestyle. Checking your phone first thing in the morning, head bent at a 30-degree angle, then scrolling on your phone at the breakfast table. Phone in the car or metro while going to office. 9 hours in front of the computer screen at office, and coming home to sit with a laptop or in front of the TV on the sofa. This cycle repeats every single day, and we wonder why we're in pain. According to research, when you tilt your head forward just 15 degrees, an extra 12 kilograms of weight is pressing on your neck. Understand? 12 kilograms. That's like carrying a bowling ball on your neck all day long, and we do this for hours and hours without even realizing it. Your neck muscles, which are designed to support 5 to 6 kilograms, are now bearing the load of 12, 15, even 20 kilograms depending on how much you bend. At 30 degrees forward, it becomes 18 kilograms. At 45 degrees, it's 22 kilograms. And at 60 degrees, which is the typical texting position, your neck is supporting 27 kilograms. Almost 30 kilograms. That's like carrying a 7-year-old child on your neck while you scroll through social media. Now let me tell you what's really happening inside your body when you experience this pain. Your neck has 7 vertebrae, small bones stacked on top of each other like building blocks. Between these vertebrae are discs, soft cushions that act as shock absorbers. Around all of this are muscles, tendons, ligaments, and nerves. When you maintain a bad posture for long periods, these muscles get strained. They become tight, they develop knots, trigger points. The blood circulation to these areas decreases, and when muscles don't get proper blood flow, they don't get oxygen. They don't get nutrients. What happens then? They start screaming in pain. But here's what most people don't understand. The pain you feel in your neck and shoulders isn't always because of your neck and shoulders. Sometimes the root cause is somewhere completely different. Your lower back, your hips, even your feet can cause neck pain. It's all connected. Your body is like a chain, and when one link is weak, the entire chain suffers. Let me share something personal with you. 2 years ago, I was exactly where you might be right now. Constant neck pain, headaches that wouldn't go away, shoulders so tight that even a light touch would make me wince. I tried everything. Painkillers, hot packs, cold packs, massage guns, expensive pillows. Some things gave temporary relief, but the pain always came back. Sometimes even worse than before. One day, the pain was so severe that I couldn't turn my head. I had to turn my entire body to look sideways. That's when I decided enough is enough. I started researching, consulting experts, trying different approaches. And what I discovered changed everything for me. The solution wasn't in expensive treatments or magic pills. It was in understanding my body, changing my habits, and doing specific exercises consistently. I remember there was this one week where I couldn't sleep properly for 5 nights straight. Every position felt wrong. I'd wake up every 2 hours because the pain would shoot down my arm. My productivity at work dropped. I was irritable, exhausted, frustrated. My relationships were affected because I was always in a bad mood. That's what chronic pain does. It doesn't just hurt physically, it infiltrates every aspect of your life. Let me break down the most common causes of neck and shoulder pain that affect 90% of people. First and foremost is poor posture. When you sit with your head forward, shoulders rounded, back hunched, you're putting tremendous stress on your upper body. This is called forward head posture or text neck. Every inch your head moves forward from its natural position adds 10 pounds of extra weight on your spine. Second major cause is prolonged sitting. Our bodies are designed for movement, not for sitting in one position for 8 to 10 hours. When you sit for long periods, certain muscles become tight and overactive while others become weak and underactive. This creates imbalance. Your chest muscles get tight, your upper back muscles get weak, your hip flexors shorten, your glutes forget how to work. All of this contributes to neck and shoulder pain. Third is stress and tension. When you're stressed, what happens? Your shoulders rise up towards your ears, your jaw clenches, your breathing becomes shallow. This muscular tension, if chronic, leads to persistent pain. Many people hold their stress in their neck and shoulders without even realizing it. They go through entire days with their shoulders hunched up near their ears, constantly tense, constantly braced for something bad to happen. Fourth is sleeping position and pillow quality. If your pillow is too high, too flat, too soft, or too hard, your neck stays in an awkward position all night. That's 7 to 8 hours of strain. Over time, this adds up and causes significant problems. Sleeping on your stomach is the worst position because it forces your neck to rotate 90 degrees for the entire night. Side sleeping is generally better, and back sleeping is ideal if you can manage it. Fifth is lack of exercise and weak muscles. If your core is weak, your upper body has to work harder to keep you upright. If your upper back muscles are weak, your shoulders round forward. If your neck muscles are weak, they can't properly support your head. Weakness leads to compensation, and compensation leads to pain. Sixth is repetitive movements at work. If your job involves repetitive overhead reaching, carrying heavy bags on one shoulder, holding a phone between your ear and shoulder, or any other repetitive strain, over time this causes muscle imbalances and joint dysfunction. Seventh is previous injuries that were never properly rehabilitated. Maybe you had whiplash from a car accident years ago. Maybe you fell and landed on your shoulder. If these injuries weren't properly treated and the muscles weren't strengthened afterwards, they leave lasting weaknesses that cause problems down the line. Eighth is vision problems. If you're straining to see your computer screen, you'll naturally lean forward or tilt your head in awkward positions. Get your eyes checked. Sometimes new glasses can eliminate neck pain. Ninth is carrying heavy bags. Backpacks that are too heavy, purses carried on one shoulder, laptop bags that weigh a ton. All of this creates asymmetry and strain. Your body has to compensate for the uneven load, and your neck and shoulders pay the price. 10th is dehydration and poor nutrition affecting muscle and disc health. Your intervertebral discs are about 80% water. When you're dehydrated, they lose height and their ability to cushion decreases. This puts more stress on the joints and muscles. Now, let's talk about the solutions. Real, practical, actionable solutions that you can start implementing today. I'm not going to give you complex medical advice or suggest expensive treatments. These are simple changes that have worked for thousands of people, including myself. Solution number 1 is fixing your posture. But here's the thing, you can't just sit up straight and expect to maintain it. You need to make it natural. Start by becoming aware. Set reminders on your phone every hour. When the reminder goes off, check your posture. Are your shoulders back? Is your head aligned over your spine? Are your feet flat on the floor? This awareness is the first step. Position your computer screen at eye level. Your eyes should be looking straight ahead, not down. If you're using a laptop, get a laptop stand and external keyboard. This single change can dramatically reduce neck strain. Keep your phone at eye level when using it. Don't look down at your lap. Bring the phone up to your face. When sitting, your chair height should allow your feet to rest flat on the floor, with knees at 90 degrees. Your lower back should be supported. Your elbows should be at 90 degrees when typing. Your wrists should be neutral, not bent up or down. The top of your monitor should be at or slightly below eye level. Solution number 2 is movement and stretching. You need to move every 30 minutes. Not just shift in your chair, but actually stand up and move. Walk around for 2 minutes. Do some simple stretches. Roll your shoulders back 10 times. Turn your head slowly left and right. Tilt your head ear to shoulder on both sides. These micro breaks prevent muscles from getting too tight and locked up. Here are some specific stretches you should do daily. The chin tuck exercise is gold for forward head posture. Sit or stand straight. Keep your eyes looking forward and pull your chin straight back like you're making a double chin. Hold for 5 seconds. Repeat 10 times. This strengthens deep neck flexors and helps restore proper alignment. The doorway chest stretch opens up tight pectorals. Stand in a doorway, place your forearms on the door frame, and lean forward gently. You should feel a stretch across your chest and front of shoulders. Hold for 30 seconds. Repeat 3 times. Do this multiple times throughout the day, especially after long periods of sitting. Upper trap stretch releases tension in those muscles that run from your neck to your shoulders. Sit up straight, take your right hand over your head, and gently pull your head towards your right shoulder. You'll feel a stretch on the left side of your neck. Hold for 30 seconds each side. Repeat 3 times. You can add a gentle downward pull with the hand to increase the stretch. Levator scapulae stretch targets that muscle that gets really tight from looking down at screens. Turn your head 45 degrees to the right, then look down towards your armpit. You can use your hand to gently pull your head further. You'll feel a stretch along the back corner of your neck. Hold 30 seconds each side. Thoracic extension improves upper back mobility. Sit in a chair, place your hands behind your head, and lean back over the chair gently looking up at the ceiling. This counteracts all that forward bending we do all day. You can also use a foam roller placed horizontally under your upper back and gently extend over it. Cat-cow stretch is excellent for spinal mobility. Get on your hands and knees. Arch your back looking up, then round your back looking down. Move slowly and smoothly between these positions 10 times. This mobilizes your entire spine and feels amazing. Thread the needle stretch releases tension in shoulders and upper back. From hands and knees, thread your right arm under your left arm, lowering your right shoulder to the ground. You'll feel a stretch across your upper back and shoulder. Hold 30 seconds each side. Child's pose is a restful stretch for your entire back. Sit back on your heels, extend your arms forward on the ground, and relax your forehead down. Breathe deeply and hold for 1 to 2 minutes. This gently stretches your lats, shoulders, and spine. Solution number 3 is strengthening exercises. Stretching alone isn't enough. You need to strengthen weak muscles to maintain good posture effortlessly. Rows are excellent for upper back. You can use resistance bands or dumbbells. Pull your shoulder blades together as you row. Really squeeze those upper back muscles. Do 3 sets of 12 to 15 reps. Face pulls target the posterior deltoids and upper back. Using a resistance band, pull it towards your face with elbows high, squeezing shoulder blades together. This exercise is a game changer for rounded shoulders. Think about pulling the band apart as you pull it towards your face. 3 sets of 15 reps. Prone Y raises strengthen lower traps. Lie face down on the floor or on a bench, arms extended overhead in a Y position. Lift your arms off the ground, squeeze your shoulder blades down and together. This builds endurance in muscles that keep your shoulders back. 3 sets of 12 reps. Scapular wall slides improve shoulder blade mobility and control. Stand with your back against a wall, arms in a goalpost position. Slowly slide your arms up the wall while keeping your back and arms in contact with the wall. This is harder than it sounds and really activates those postural muscles. Band pull-aparts strengthen rear delts and upper back. Hold a resistance band in front of you with straight arms. Pull the band apart, stretching it across your chest while squeezing your shoulder blades together. Do 3 sets of 20 reps. This is great to do between sets of other exercises or as a movement break during work. Planks and dead bugs strengthen your core, which is the foundation of good posture. A strong core means your upper body doesn't have to work as hard to keep you upright. Hold planks for 30 to 60 seconds. 3 sets. For dead bugs, lie on your back, extend opposite arm and leg while keeping your lower back pressed to the floor. This teaches core stability. Farmers carries build overall postural strength. Hold heavy weights in each hand and walk for 30 to 60 seconds. Your entire body has to work to maintain upright posture under load. This translates directly to better posture in daily life. Wall angels are fantastic for shoulder mobility and posture. Stand with your back against a wall, arms in goalpost position. Slowly raise and lower your arms like making a snow angel while keeping everything in contact with the wall. This is challenging and reveals mobility restrictions. Solution number 4 is optimizing your sleep setup. Invest in a good pillow that keeps your neck in neutral alignment. Generally, side sleepers need a thicker pillow to fill the space between the shoulder and head. Back sleepers need medium thickness to support the natural curve of the neck without pushing the head too far forward. And stomach sleepers, which you shouldn't be, need very thin pillows. Or, better yet, don't sleep on your stomach at all. It forces your neck to turn 90 degrees for hours. Your mattress matters too. Too soft and you sink in awkward positions. Too hard and it doesn't cushion pressure points. Medium firm is usually best for most people. If your mattress is old and sagging, it's time for a new one. Your sleep setup is where you spend a third of your life, so it's worth investing in quality. Consider your sleeping position. Back sleeping is ideal if you can manage it. Place a small pillow under your knees to reduce lower back strain. Side sleeping is fine too. Place a pillow between your knees to keep your spine aligned. Avoid sleeping with your arm under your pillow as this can compress nerves and cause shoulder problems. Your bedroom environment matters. Keep it cool, dark, and quiet. Temperature between 60 to 67 degrees is ideal for sleep. Use blackout curtains. Consider a white noise machine if you're sensitive to sounds. Quality sleep helps your body recover and reduces pain. Solution number 5 is managing stress. Stress is a huge contributor to muscle tension. Find ways to release it. Deep breathing exercises work wonders. Try this. Breathe in slowly for 4 counts, hold for 4 counts, exhale for 4 counts. Do this for 5 minutes daily. It activates your parasympathetic nervous system and helps muscles relax. Box breathing is another powerful technique. Inhale for 4 counts, hold for 4, exhale for 4, hold for 4. Repeat for several minutes. This brings your nervous system into a calm state and releases muscular tension. Progressive muscle relaxation is another powerful technique. Tense each muscle group for 5 seconds, then release. Start from your toes and work up to your neck and face. This teaches you to recognize tension and let it go. Many people discover they're holding tension they didn't even know was there. Meditation, yoga, walking in nature, listening to music, whatever helps you unwind, make time for it. It's not luxury, it's necessity. Even 10 minutes a day of something that relaxes you can make a massive difference in your pain levels. Journaling can help process stress and emotions. Sometimes pain has an emotional component. Writing down your thoughts and feelings can be surprisingly therapeutic and reduce the physical manifestation of stress. Solution number 6 is heat and cold therapy. Heat increases blood flow and relaxes tight muscles. Use a heating pad or warm towel on your neck and shoulders for 15 to 20 minutes. Cold reduces inflammation and numbs acute pain. Use an ice pack wrapped in a cloth for 10 to 15 minutes. For chronic tightness, heat usually works better. For acute injury or inflammation, cold is more effective. Contrast therapy alternating between hot and cold can be very effective. 3 minutes hot, 1 minute cold, repeat 3 times ending with cold. This pumps blood in and out of the area, bringing fresh nutrients and removing waste products. Hot showers or baths with Epsom salts can be incredibly soothing. The magnesium in Epsom salts may help with muscle relaxation. The heat, combined with the relaxing environment of a bath, reduces tension significantly. Solution number 7 is proper hydration and nutrition. Your muscles and discs need water to function properly. Dehydration makes muscles more prone to cramping and pain. Aim for at least 8 glasses of water daily. Your spinal discs are mostly water. When dehydrated, they lose height and cushioning ability. Anti-inflammatory foods can help reduce pain. Omega-3 fatty acids from fish, flax seeds, walnuts, turmeric, ginger, berries, leafy greens. Avoid processed foods, excessive sugar, and trans fats which promote inflammation. Magnesium is crucial for muscle relaxation. Many people are deficient. Foods rich in magnesium include spinach, almonds, avocados, dark chocolate, and bananas. You can also consider a magnesium supplement if you're deficient. Vitamin D is important for bone and muscle health. Many people are deficient, especially those who don't get much sun exposure. Get your levels checked and supplement if needed. Protein is essential for muscle repair and recovery. Make sure you're eating enough quality protein throughout the day. Your muscles need amino acids to rebuild and strengthen. Now let me address some common mistakes people make when dealing with neck and shoulder pain. Mistake number 1 is ignoring the pain and pushing through. Pain is a signal. Don't ignore it. Address it early before it becomes chronic and much harder to fix. Acute pain that's addressed quickly often resolves completely. Chronic pain that's been ignored for months or years is much more complex to treat. Mistake number 2 is relying only on pain medication. Pills mask symptoms, they don't fix the root cause. They have their place for severe pain, but they shouldn't be your only strategy. Long-term use of pain medication can have side effects and doesn't address why you're in pain in the first place. Mistake number 3 is getting aggressive massage or manipulation without proper assessment. Sometimes aggressive treatment can make things worse, especially if there's an underlying condition like a herniated disc or nerve compression. Deep tissue massage feels good in the moment, but if done too aggressively on already inflamed tissues, it can increase inflammation. Mistake number 4 is doing random exercises from the internet without understanding your specific issue. Not all neck pain is the same. What works for one person might not work for another. If possible, get assessed by a physical therapist who can identify your specific weaknesses and imbalances. Mistake number 5 is expecting quick fixes. If you've had pain for months or years, it won't disappear in a week. Consistency is key. Small daily actions compound over time into significant results. Give yourself at least 4 to 6 weeks of consistent effort before evaluating progress. Mistake number 6 is doing exercises with poor form. Quality over quantity always. 10 perfect reps are better than 20 sloppy reps. Poor form reinforces bad movement patterns and can make things worse. Mistake number 7 is not addressing the root cause. If your workspace ergonomics are terrible, no amount of stretching will permanently fix your pain. You have to address the source of the problem. Let me also talk about when you should seek professional help. If your pain is severe and persistent, despite trying these solutions for several weeks, see a doctor. If you have numbness or tingling in your arms or hands, that could indicate nerve compression. If you have weakness in your arms, trouble gripping things, or loss of coordination, these are red flags. If the pain follows an accident or injury, get checked immediately. If you have fever along with neck pain and stiffness, it could be serious like meningitis. If you have pain that wakes you up at night or pain that's worse at night, get it checked. If you have unexplained weight loss along with pain, see a doctor. If you have a history of cancer and develop new neck pain, get evaluated. These are warning signs that it might be something more serious than simple muscular pain. But for most people, the kind of pain that comes from modern lifestyle and poor habits, these solutions will work. I've seen it work for countless people. It worked for me. After implementing these strategies consistently for 3 months, my pain was 90% gone. After 6 months, it was completely resolved. Now, 2 years later, I'm pain-free as long as I maintain good habits. Here's what I want you to do starting today. Right now, check your posture. Adjust your screen height. Set hourly reminders to move and stretch. Tonight, before bed, do 5 minutes of the stretches I mentioned. Tomorrow morning, do the chin tuck exercise 10 times. Start small, but start today. Create a routine. Morning routine, 5 minutes of stretches when you wake up. Work routine, stand and move every 30 minutes. Evening routine, 10 minutes of stretches and strengthening exercises before bed. Weekend routine, longer session of mobility and strength work. Understand that your body has an incredible ability to heal and adapt. You just need to give it the right conditions. Stop the habits that are causing damage and start the habits that promote healing. It's that simple, but it requires commitment. Think about this. What would your life look like without this constant pain? Imagine waking up feeling refreshed, not reaching for your neck first thing. Imagine working through the day without that nagging ache. Imagine turning your head freely, lifting your arms without discomfort, sleeping through the night peacefully. That's not a fantasy. That's absolutely achievable. Your neck and shoulders carry more than just physical weight. They carry your stress, your worries, your tension from life. When you take care of them, you're not just eliminating pain. You're improving your quality of life, your productivity, your mood, your sleep, everything. I want to share one more story with you. There was a woman in one of my workshops who had suffered from neck pain for 15 years. 15 years. She had tried everything: physical therapy, chiropractors, acupuncture, medication. Nothing worked long-term. She was at the point of considering surgery. Then she implemented the strategies I taught her: the posture awareness, the daily stretches, the strengthening exercises, the stress management. Within 2 months, her pain had reduced by 50%. Within 6 months, she was pain-free for the first time in 15 years. She cried when she told me. She said she had forgotten what it felt like to live without pain. That's possible for you too. I don't care how long you've had pain. I don't care how many things you've tried. Your body still has the capacity to heal. You just need the right approach and the commitment to stick with it. Remember, every expert was once a beginner. Every person who overcame this pain started exactly where you are right now. The only difference is they decided to take action. They committed to the process. They stayed consistent even when results weren't immediate, and eventually they broke free from the cycle of pain. You can do this too. Your body wants to heal. Your muscles want to function properly. Your posture wants to be correct. You just need to support these natural tendencies with the right actions. So make a decision today, not tomorrow, not next week, today. Decide that you're not going to live with this pain anymore. Decide that you're worth the effort. Decide that 15 minutes of daily exercises and stretches is a small price to pay for a pain-free life. Start implementing these solutions one by one. Don't try to do everything at once and overwhelm yourself. Pick 2 or 3 things from what I've shared and master them first. Then add more. Build momentum gradually. Track your progress. Notice the small improvements. Maybe one day you realize you worked for 2 hours without neck pain. Celebrate that. Maybe you sleep through the night without waking up from discomfort. That's progress. These small wins compound into massive transformation. Keep a pain journal. Rate your pain level daily on a scale of 1 to 10. Note what makes it better or worse. This helps you identify patterns and see progress over time. Often we don't notice gradual improvement unless we're tracking it. And finally, be patient with yourself. Some days will be better than others. Some days the pain might flare up again. That's normal. It's not linear. What matters is the overall trend over weeks and months, not day-to-day fluctuations. Don't beat yourself up if you have a bad day. Don't quit if you miss a day of exercises. Just get back on track the next day. Progress isn't about perfection. It's about consistency over time. Your journey to a pain-free neck and shoulders starts now. You have the knowledge, you have the tools, you have the ability. All that's left is action. Take that first step today. Your future self will thank you for it. The pain you're feeling today doesn't have to be your reality tomorrow. Every moment is a chance to make a better choice for your body. So stand up right now, roll your shoulders back, take a deep breath, and commit to taking care of yourself. You deserve to live without pain. You deserve to feel strong and comfortable in your body. Now go make it happen. The power is in your hands. Use it.